Well, Governor Reynolds has just wrapped up her weekly COVID-19 response briefing. And during that briefing, she said we are on track to get all Iowans vaccinated by the first week of April. Our political director, Dave Price, was at that briefing and joins us live with more. Hi, Dave.
Hi, Jody. The governor said that because the supply of the vaccine is expected to increase enough beginning April the 5th, she expects that all Iowa adults will be eligible to start signing up for these COVID-19 vaccinations. Doesn't mean everybody can get it, of course, because the supply still will not be able to meet demand. But here's how she laid out why she's feeling better about things.
I am pleased to say that we remain on target to open vaccination to all Iowans beginning Monday, April 5th. When this occurs, once again, there is going to be more demand than supply at first, just as we've experienced each time eligibility was expanded. So please be patient as our weekly allocations continue to increase. So will the number of appointments available, and soon there will be enough vaccine for everyone.
The governor also addressed the balance that is needed for this. We have been hearing from viewers over the last couple of weeks in particular as they look ahead to this April 5th change when more people will now be trying to get these vaccinations. And the governor said the idea is that they move through different thresholds, and 70% is kind of that benchmark. So when they feel like they've been able to reach 70% of teachers, 70% of law enforcement, 70% of seniors, as they keep ticking through these categories, they then allow more people to become eligible. And that's why she feels they're moving toward that direction for April the 5th. They are moving through those target demographic areas. So then starting April 5th, you can make a lot more people eligible. Keeping in mind, of course, she's already opened this up to people under the age of 65 who have some kind of chronic condition. And unfortunately, if you start looking through health records, most adults do qualify because they have one of those existing chronic conditions. So starting April 5th, this will open it up to even more people. But most people, as we stand here today, are already eligible to start signing up to try to get one of these vaccinations, Jody.
And Dave, the governor also talked at length about people of color getting vaccinated. We know that 1% of African Americans and just under 2% of Latinos are vaccinated in the state. She talked about the efforts to get those communities and populations vaccinated.
And that it has been a real challenge. Now, she talked about they don't know for sure that those numbers are correct in the sense that some of it is you have to self-report when you sign up for these and when you actually get a vaccination. And I think she said somewhere around 20% of people don't check off or don't report here at all. So maybe the figures aren't accurate. However, they do know that as a rule here, fewer people of color are getting these vaccinations. So she is highlighting some different areas. Some of it is through the United Way, some is through church groups, some through county health departments, but they are trying to more actively engage, including reaching people who don't speak English as their first language at home, realizing that that's an additional barrier to overcome to make sure those folks know they can be eligible and know where they can get these vaccinations.
All right, our Dave Price reporting live for us in Johnston this morning. Thank you.